hello to everyone, my dear students and viewers. I, Dr. Megha Choudhary, welcome you all in my surgery online class. We have done with the anatomy part of thyroid and we have understand the hyperthyroidism when there is excess secretion of thyroid hormones from the thyroid gland. Thyroid gland is a butterfly-shaped endocrine gland situated in the neck and it has two lobes connected by isthmus. It lies anteriorly to the trachea between the cricoid cartilage and the suprasternal notch. It weighs 20 grams and it is a highly vascular organ. There are a set of 4 parathyroid glands which are located posteriorly to the pole of thyroid gland. Let's understand the regulation of thyroid axis. Hypothalamus secretes TRH, that is thyroid releasing hormone, and then pituitary stimulates TSH, that is thyroid stimulating hormone, and in that response thyroid gland secretes T3 and T4 hormones, the thyroid hormones, and in this way the feedback mechanism also occur. When excess of thyroid hormones get secreted, then this message is sent to the hypothalamus and pituitary to secrete the less amount of TSH and TRH. In last topic we have done the hyperthyroidism, how the excess secretion of T3 and T4 occurs, and the condition known as exophthalmos when bulging of eyes occurs and goiter occurs in the gland. The diffuse enlargement of the thyroid gland is known as goiter. Today's topic of discussion is hypothyroidism, where the inadequate secretions of thyroid hormones occur. Hypothyroidism is categorized into primary hypothyroidism and secondary hypothyroidism. In case of primary hypothyroidism, there is normal secretion of TSH from the pituitary gland, but in response to that, thyroid hormone T3 and T4 are secreted in less amount. There is defect in feedback mechanism. Whereas in case of secondary hypothyroidism, there is low secretions of TSH, that is thyroid stimulating hormone, from the pituitary gland due to the presence of tumors, adenomas or malignancy. So in response, there is inadequate secretion of T3 and T4 from the thyroid gland. The main cause for hypothyroidism is Hoshimoto's thyroiditis. It is an autoimmune disorder. This is the most common cause of hypothyroidism. This happens when the body's immune system produces certain antibodies that attack its own thyroid gland, leading to a reduced thyroid hormone production. Second reason could be radiation therapy. Exposure of the thyroid gland by radiation therapy for the treatment of cancers of the head and neck region. Damage to the pituitary gland can also be reason. The pituitary gland may be damaged due to disease or surgery, which may result in decreased level of thyroid hormones. Other causes could be medications. A number of medications can cause hypothyroidism. Lithium, which is used to treat certain psychiatric disorders, can also affect the thyroid gland. The other reason can be genetic dysfunction. Thyroid gland may be dysfunctional at birth or may fail at some phase in adult life. There could be previous thyroid surgery. Removal of a large portion of the entire thyroid gland may reduce or stop the process of thyroid hormone production. Another reason could be the treatment for hyperthyroidism. Treatment for hyperthyroidism may sometimes result in hypothyroidism. Now let's learn the clinical presentation. In clinical features, you will notice the dry skin and coarseness. There could be fatigue, weakness, lethargy, increased sensitivity to cold. Constipation is very marked feature. Dry skin with weight gain, puffy face, hoarseness of the voice, muscle weakness, elevated blood cholesterol level, muscle aches, tenderness and stiffness, pain, stiffness and swelling in the joints, heaviness, thinning of the hair, slowed heart rate, depression, anxiety, and impaired memory with menstrual disturbances. In extremities, there will be coldness, carpal tunnel syndrome. In muscles, there will be relaxation with delayed reflexes. In heart, there will be slow pulse rate with pericardial effusion. In pharynx, there will be hoarseness. Ears will present as a poor hearing. Psychological features will be poor memory with poor concentration. General features will be fatigue, weakness, weight gain with poor appetite. There will be hair loss. In lungs, there will be shortness of breath with pleural effusion in latter cases. In skin there will be myxedema and paresthesia. In intestine there will be ascites and constipation. In investigations, history and physical examination of the patient is done. Then patient is recommended for the thyroid function test. Serum TSH and serum T3, T4 levels are checked. TRH stimulation test is done along with serum cholesterol is also checked. Now let's understand the synthesis of thyroid hormones. First step is trapping of iodide from the plasma iodide. Second step is oxidation of iodide. Then the iodization of tyrosine in thyroid gland to form MIT and DIT. Two MIT are coupled to form T4, one MIT and DIT are coupled to form T3. Then the storage of these hormones in thyroid gland occur and this releases in blood. And then the transformation of T4 hormone into the T3 hormone occurs. Treatment of hypothyroidism includes thyroid hormone replacement and levothyroxine medicines are given. Thyroid hormone levels are monitored and adjusted with the dosages. Nutritional therapy with iodine is given to promote the weight loss.